FetalCare, a mobile cardiac tachograph system. Recently, the problem of elderly preterm gravity has been an issue in many developed countries. Since the elderly preterm gravity have high preterm birth rate, the demand of the tachography is increasing. In this video, a remote access system of CTG cardiotachograph developed by NCTU and ITRI from McCain Memorial Hospital will be presented. With this system, doctors can check real-time CTG via smartphone to make medical decisions immediately. Let's take the situation in Taiwan as an example. The data in these charts are collected from Department of Household Registration, MOI, Taiwan. It can be noted that the trend of the age of preterm gravida is climbing, from age of 26.7 in 1999 to 30.4 in 2013, and the average age has increased 3.7 years old. In addition, it has been reported that the preterm birth rate increases 20% for elderly preterm gravity. This situation brings an important social issue of preterm birth problems since preterm born infants usually have rudimentary organs, and this causes not only health problems but also the risk of death to preterm born infants. Therefore, many care centers and hospitals establish tachographic centers to cope with this social issue. The major purpose of tachography is to avoid early childbirth and keep the infant in the uterus such that the infant can have enough time to develop and reduce the risk of preterm birth. Cardiotachogram is the main equipment in a tachographic center. The equipment shown on the left side of the figure is the Tsì-Uí matrix. Its functionality is to monitor fetal physiological signals such as fetal heart rate, FHR, and uterine activity, UA, record the events of fetal movement and mark it by the pregnant woman, and print out the cardiotachograph as shown in the right side of the figure. In the cardiotachograph, the waveform in the upper part is FHR. The waveform in the lower part is UA. And the black rectangles on the top are the marks of the fetal movement events. In order to reduce the working load for the nursing staff, the Maya CTG system is deployed in the tachographic center of the McCain Memorial Hospital for the CTG data monitoring. The Tsì-Uí matrix introduced previously collected CTG data from the pregnant woman to the Maya server and display in the nursing console. Nurses can query the CTG data via the nursing console and inform the doctor if an abnormal condition occurs. However, if the doctor is not on site, nurses need to call out the doctor, and the CTG data will be sent to the doctor for the medical decision. Since the CTG data were in the paper form, nurses have to take pictures for the CTG data one by one manually. This method is time-consuming and the doctor can't make the medical decision immediately. Apparently, this solution is not convenient and cannot provide real-time monitoring and medical decision. Therefore, we developed a mobile solution called FetalCare to support real-time accessibility for a cardiotachograph on the Maya system. By this means, nurses have no longer to send a cardiotachograph in photos. The FetalCare system consists of three components: notification website, FetalCare app, and FetalCare database. With this system, as an abnormal event is observed, nurses can use the notification website to send an alert message to the attending doctors. After the doctors receive the message from the FetalCare app, they can use this app to retrieve the real-time waveform information of FHR and UA. FetalCare database is responsible for backing up the data in the Maya system. The waveform information can be retrieved from FetalCare database and later sent to smartphones. This is the UI screen of the notification website. Notification website has the function to trigger alert notification. Nurses can trigger a notification alert by pushing a button with bed number to the attending doctors. These are the UI screens of the FetalCare app. The figure in the left side is a screenshot that illustrates the notification received by the app. Doctors can track pregnant woman's state via the app as shown in the middle figure. In addition, doctors can also check the CTG data of pregnant woman via the app as shown in the right figure. Next, we illustrate the operating procedures of the FetalCare system via a practical application. Suppose a pregnant woman named Alice is being cared in a tachographic center and her bed number is 2B, At this moment, a nurse finds Alice has an abnormal condition. The nurse then pushes the button with Alice's bed number to trigger an alert notification to a doctor. After the notification is sent, the button with Alice's bed number, both in the notification website and the FetalCare app, will become red. This indicates the doctor doesn't check Alice's situation yet. After that, the alert message will be shown in the notification bar of the FetalCare app in the doctor's smartphone. The doctor can click the notification message to check Alice's condition. The FetalCare app will retrieve Alice's CTG data from the FetalCare database to display the CTG waveform in real time. At the same time, the button with Alice's bed number in the notification website will change to blue, which indicates the doctor has checked Alice's condition. This is the screen of the real-time mode of the FetalCare app. The app will continuously update the CTG data. The doctor can also scroll back the diagram for early CTG data. The doctor can make medical decisions to the nurses according to the CTG data provided by the FetalCare app. In the historical mode, the doctor can check the historical CTG data by clicking a historical alert message. The CTG data within 1 hour to the abnormal event will be displayed. In this mode, the doctor can examine the historical CTG data to see the condition of the pregnant woman. Currently, the FetalCare system is on the way to integrate with Maya system at McKay Memorial Hospital. It utilizes mobile technologies to alert doctors about abnormal situations so that the nurses in the diagnostic center can notify the attending doctors immediately. Even if the doctors are not on-site, they still can remotely access the physiological signal of a pregnant woman to make a medical decision in real time by the smartphone. Thank you for your attention.